Hi, everybody. I'm Michelle Cades. I am the president of Fairfax County SEPTA. I'm delighted that so many people have been able to join us tonight. Thank you for your patience with our rescheduling. Really do appreciate it. I hope everybody is well and healthy and had a restful summer as best we can. And I hope everyone's first week of school for their kiddos or classes went smoothly. So just really briefly, here's what's going to happen with tonight's meeting. We have a few minutes of brief SEPTA business to quickly cover, and then we're going to jump right into our Q&A. I'm delighted that we have a wealth of FCPS administrators who have joined us this evening. And we sent a long list of questions to the FCPS staff in advance of this meeting, and found out that they actually have come back to us with a whole PowerPoint presentation with all of our questions. So it's going to be a little bit different from some of the programs we've done in the past, but we will absolutely ask them questions as we go along. And then we're going to play things by ear in terms of timing for whether or not we can take more questions. So if you do have questions, you're welcome to put them in the chat. One of our board members will be keeping track of them. And in general, I'm just going to ask that everybody please be keep your microphones muted unless you're called on to be speaking. Please be kind and polite and all those nice things so that we can keep you all in the meeting. And I'm really excited that we're all here. So I do want to just start off with our brief SEPTA business. Amanda has pointed out if you need captioning, you can turn that on in your options on the menu at the bottom of your screen. So there's live captioning running. You should be able to turn it on or off. So hi, I'm Michelle. I'm the SEPTA president, and we have many of our SEPTA board members here with us. Those of you who are SEPTA board members, if you are comfortable turning on your cameras this evening, feel free to do so. And I'm just going to run down and have folks who want to say hello to please go ahead and do so. Diane, we'll start with you. Just say hi and your position.
Hi, I'm Diane Cooper-Gould. I'm SEPTA's advocacy chair, and tonight I will be Michelle's sidekick. So,
Amanda.
Hi, everybody. I'm Amanda Campbell. I'm SEPTA's vice president, and I am tech support tonight. So my video will be off, but I am hovering in the chat. Feel free to message me if you need me.
Kate. Kate is our liaisons chairperson, so she is a face that many of you will be connecting with. I'm delighted we have many of our liaisons here this evening. So if Kate gets a chance to turn on her camera and wave, then I'm sure she will do that. Jen, if you're available to say hi.
Hello, I'm Jen Beneke, and I am the awards chair. So I'm hoping we can have a really nice party this year for all the hardworking staff and teachers that support our special education.
Excellent, thank you. Emily, one of our newest members of our board.
Oh gosh, I'm really dark. Sorry. Okay, I pretend you see an actual face. I'm Emily. I'm new this year to the board. Last year was as just a SEPTA liaison to Churchill Road Elementary. Delighted to be here and join you all. And I will be working on 2E this year, twice exceptional.
Fantastic. And we do have an opening for a co-chair person. If anyone is interested in also helping us out with 2E, please message us and let us know. Kathy.
Hi, I'm the person who recruits new board members and new people to do all the work that SEPTA does.
Thank you. Amy.
Hi, I am the teacher educator chair on the board. I have my camera off because I have a sinus infection and no makeup, and it is day 6 of school, so I apologize. But I'm super excited to be on the SEPTA board and work on behalf of my school and my people and just bring the T part of SEPTA in.
Love it. Thank you. Margaret, another one of our newest members.
Hi, I'm Margaret Behrens, and I've been involved with SEPTA for a few years. I'm happy to come on board and help brainstorm how we can reach underserved cultural groups specifically.
Thank you. We're delighted to have you with us as well. Lenora, if you're able to say hi. I believe you're.
Hi. Yeah, I can talk. I just can't see me. So I'm Lenora Gums, and I am the membership chair. And I forgot what else I was supposed to say, but I think that's it. So we look forward to helping to work with anyone who wants to help recruit more members.
Fantastic. And we're delighted that you've joined our board as well. Sherry, want to introduce yourself?
Hi, everyone. Welcome to the event. I'm Sherry Belkowitz. I am the events chairperson for SEPTA. So if you have any ideas for upcoming events, you can reach out to me.
Awesome. Thank you. Hopefully I covered everybody on our board. If I missed anyone, somebody yell at me and let me know. So as I mentioned,
I'm here as the lead.
Oh, go ahead. Oh, yes.
Sorry. I'm Ali Baldessari. I'm the liaison to the Advisory Committee for Students with Disabilities, also called the ACSD, representing SEPTA on the ACSD for the 3rd year in a row.
Thank you. Excellent. I just love that your name just came up on my screen as Alibaba. Technology, it's great. So as I mentioned, we are looking for another 2E co-chairperson. So if there's someone out there who's interested in helping us out with 2E, that is fantastic. We would love that. Also, we are looking for a fundraising chair. And I know that people who love to do fundraising are sometimes few and far between. Nevertheless, I'm sure you're out there somewhere. So we are in the interim looking at planning an armchair fundraiser, which you will get information about soon. So if we do that, then we don't have to sell you wrapping paper or donuts or candles or have a readathon or a runathon or a hoopathon or any-a-thon, and we're just going to ask for donations because we gave away $5,000 last year in mini grants to our staff who work directly with our students, and they set up projects such as a sensory room, stationary pedal machines, an outdoor learning space, library books featuring differently abled characters, all sorts of great stuff. So I'm just going to point blank say, because I'm uncomfortable asking for this, if you can donate to us, please do. A private therapy appointment costs around $125. So if you think we're worth a therapy appointment, please go ahead and make a donation to us for a therapy appointment. That being said, I'm going to move on to a couple of our other quick pieces. We also would like you to join SEPTA if you're not yet a member. To join, go to our website, fairfaxcountysepta.org, or you can go to our PT board, which is fcsepta.ptboard.com. Thank you, Amanda, just put that in the chat. And really our membership is our voice. And I think the fact that we have so many FCPS administrators joining us tonight really demonstrates that we've built up a relationship with these folks who are here with us. And the more of you who can add to our voice, the better. Also, for our FCPS staff who are joined us this evening, our mini grants application is open and live for our first round of mini grants. The deadline is September 15th. So FCPS staff, if you have colleagues who you think might want to apply for a mini grant, please go right ahead and share the link, which we can also get in the chat and is also on our website. We would love to be able to give away the money that we're raising as we speak. So
Michelle, do you want to add, to receive a mini grant, you do have to be a SEPTA member, but our staff memberships are very low. They only cover the dues that we have to pay to Virginia PTA and National PTA. So our staff memberships are $6. And we also, parents, you can give the gift of a staff membership, or anyone can give the gift of a staff memberships.
Absolutely, thank you. So staff, please feel free to join and also apply for our mini grants, which we're going to be awarding over the course of the year. Coming up, we have our, well, first was to be official, general membership meeting, although I think at this point, this counts as the first one. The next one will be on Tuesday, September 21st. Our hope is to be having our meetings hybrid style, both in person and remote, where the in-person would be over at Gatehouse. However, we are going to be keeping a very close eye on what's going on with COVID and consulting with people in the medical field who can advise us on safety regarding that, because that's our top priority, of course. Also, I did get a tip from the office of Melanie Marin that there's going to be a disability safety event in the Hunter Mill District on October 23rd. So mark your calendar in advance. It's going to be from 10 to 1, though I don't have a location yet. And it's going to include things like practice police traffic stops. So opportunities like this don't come along all that often, but they're really wonderful for our population. So keep your ears out for more information on that piece. Also, we are working on our budget, and we will need to have our membership approve our budget. So for our paid members, keep your eyes out for information coming out from us about our proposed budget and our annual audit. All right, Amanda, Diane, did I miss anything important from my SEPTA business perspective? I don't think so. If I did,
don't think so.
I don't think so either. I think
Great.
you got it.
All right, then in that case,
I
yes,
actually just
go
thought of
ahead.
something. So one thing you did mention tonight, we're going to play it by ear in terms of timing. We had initially kind of envisioned this to be a community connections event after we had updates from staff, but due to all of the COVID news and questions we've been getting, it will probably go more towards the Q&A and the presentation than the community connections. But if you are interested in community connections, there was the idea that maybe we could stay for an extra half hour tonight. So from 9 to 9:30, just to mingle and meet other parents, or we could potentially do something in the future and wrap it into another event.
Yep, one piece of feedback that we received last year is that folks would like additional time to be connecting with one another besides on our very busy Facebook page. So we really want to take that suggestion to heart. But this grew astronomically. So I also want to thank and welcome some of our school board members who have joined us this evening. Rachna Sizemore-Heiser has joined us along with Laura Jane Cohen and Karen Corbett Sanders. So welcome to you all. Thank you very much. I hope I didn't miss any others who snuck in under the radar. We have Dr. Scott Brabrand with us this evening, and Michelle Boyd is our Assistant Superintendent for Special Services, and Mike Bloom is the Director of the Office of Special Ed Instruction. So, and then there are many other FCPS Central Office folks that I'm not going to rattle off all of them and their names and titles because honestly, I can't. So at this point, I'm going to turn it over to you all.
To Mike.
To Mike, yep. Unless Dr. Brabrand, you had some opening comments that you wanted to make.
Michelle, I did come tonight. I wanted to have a chance before you all had your meeting to bring greetings and to just thank you for your leadership, Michelle, and your team. It really is great to have our team here tonight. Our board members are here. Our leadership, senior leadership is here with a message to you that we're going to continue to partner with you through the pandemic. We all wish the pandemic were over. We know that we're going to have to live with this pandemic. It's going to be something with us really beyond just the short term. And now as we're returning kids to 5 days of in-person instruction, our partnership remains more important than ever. You're going to learn a lot tonight. You asked a lot of questions, and one of the leadership lessons from the pandemic is to keep calm. So we really do have to continue to encourage our community and all of us to keep calm during this pandemic, but also an obligation to provide clarity. And tonight we're going to work to provide clarity on some of the key questions you've asked us and have it, as you said, in documented slides so you can see, you can understand and ask questions. We're going to talk about COVID case information and how we're communicating it. I know that's an area that folks want to hear about. We're going to talk about contact tracing. You're going to get details on that. We're going to talk about what a pause is, what a quarantine is, what isolation is. We're going to talk about support for students with disabilities during any of these COVID-related closures. And we're also going to talk about all of our layered mitigation strategies in schools. So our team is here to help. I may not be here for the entire thing as I'm juggling quite a few things in the return to school this week and next week, of course, in the whole year. But we're here to provide the calm, but also the clarity so that folks can get their questions answered. And we'll continue to do that throughout the year, working with you guys. So I'm going to turn it over to Dr. Boyd and her team and let you get right into the meat of the questions you asked and the answers that you want. So Dr. Boyd.
Thank you so much, Dr. Brabrand. Michelle, did you want to interject something? I'm sorry.
No, I was just going to say thank you to Dr. Brabrand. We weren't expecting that you were joining us this evening, and it's a really wonderful surprise to have you. So thank you very much for jumping in tonight.
You're welcome, Michelle.
Thank you. And just as I bring greetings, Mr. Bloom, if you would go ahead and put up the slide deck. But again, we are extremely grateful that Dr. Brabrand and a number of board members have joined us this evening. Again, as Dr. Brabrand shared, I think that just speaks volume about the partnership and the commitment and the willingness to collaborate and to get your feedback. As Dr. Brabrand shared, we're in this pandemic. We know it's evolved over time. We have process and procedures, but as any good thing, we continue to reflect upon the feedback that we get, look at changing circumstance, and we adjust accordingly. And so before we begin, I do want to take the opportunity to introduce the DSS team and also to introduce a partner that we have with us from the Fairfax County Health Department. As Dr. Brabrand shared, much of the information tonight, based on the questions submitted, deal with COVID-19, and understandably so. That's health and safety is pressing and is paramount for students, staff, and families. And so at this time, I know some folks have raised their hand, but I just want to share to make sure everyone this evening knows who they are. So I think you all know Mr. Mike Bloom, who is the director of the Office of Special Education Instruction. Many of you know Dawn Schaefer, but in a previous capacity. Dawn is serving as our acting director of the Office of Special Education Procedural Support. So there's Dawn, and I'm going down on how they look on my screen. Our other director that's here is Deb Scott, who is our Director of Intervention and Prevention Services. We also have our Director of Operations and Strategic Planning, Ms. Leah Sterpsky. And she may not be pinned to the front. We also have Ms. Robin Wallen, who I won't pretend to regurgitate her title, but Robin really serves as a key point person from the Fairfax County Health Department and has really been instrumental in partnering with us. Robin has background in schools and now works with our local health department. So it's really good to collaborate and talk with her about the supports and systems within our schools. We also have a few other persons from DSS here. I think I saw Ms. Tina Wilkerson, who many of you all know, who provides leadership and support around autism and our enhanced autism classes. And do I see any other FCPS DSS persons on the call as I'm scrolling? And certainly I do want to take time to also recognize our board members. I believe we have Ms. Roshna Sizemore-Heiser here present today. Roshna, if you want to wave your hand before we get to talking for some time.
Hello, everybody. Good to see you all.
And we also have Ms. Laura Jane Cohen, who I believe is here as well. You want to wave your hand?
Hi, thanks for having me. I'm excited to be the ACSD liaison this year.
And I think we also have maybe have some other folks who may be watching and listening, and any other board members. Ms. Karen Corbett-Sanders, there you go. Would you like to wave your hand?
Hi, everybody. Thanks for inviting us tonight. This is a really important discussion, so we appreciate being here.
And we also, as I click down, we have a number of persons. Debbie Lorenzo, who is here, she serves on our instructional team and is a coordinator there. We have, I believe, Judy Dupree, who serves for leadership for related services. And you're probably asking, why do we have so many people here from the FCPS side? Again, it's the importance of the information, wanting to ensure that we can respond to all of your questions, and because it truly takes a team, a comprehensive team of a number of persons to create systems and supports as we navigate this pandemic. So at this time, and I hope I didn't omit anyone, we'll have time to catch up if I've missed anyone. So I see we have some PSLs here as well. Ms. Christina Roman, who is actually serving in a different leadership capacity for us. But we'll move forward because I know we have to be respectful of your time. And we certainly want to make sure that we spend the bulk of our time going through the content. You've heard the remarks from Dr. Brabrand as we look at our agenda. He's given us some opening remarks that he's sharing with you. And then the bulk of the presentation this evening will be addressing the questions that you've submitted as an organization to FCPS that we're going to spend time to respond to. So I'll just open us up and then I will turn it over to the directors who will talk through their different areas, whether it's health services, special education instruction, procedural support, or intervention and prevention services. So just in opening us up as we go to the next slide, we just want to highlight for you some key information and terminology before we begin. We know that in this pandemic, we've heard the word pause to in-person instruction, we've heard the word quarantine, and we've also heard the word isolation. And just to ensure that we all have a common vocabulary before we begin, because we'll be using the terms pause, quarantine, and in isolation throughout this presentation, we want to make sure we all have a common understanding. So when we say pause, that's referring to when FCPS is directed by our local health department to pause students or staff's access to in-person instruction while contact tracing is implemented as a matter of public health. So at that time, we take that direction from the health department. We identify persons who are potentially close contacts based on a definition that we'll talk through later this evening. And we pause their access to in-person instruction and activities to minimize the likelihood of spread of disease in our schools. So that is being done to keep our students, our staff, and our families safe. You'll also hear the word quarantine. Quarantine is used when we're referring to persons who have been identified by the health department as close contacts. That means that that person does not have COVID-19, but that person has been identified as a close contact of somebody who does have COVID-19. And quarantine, and we'll talk later in this presentation, the quarantine in our health district is 14 days, and we'll talk through that process. Last but not least, you'll hear the term isolation. Isolation is used when we're referring to an individual who has tested COVID-19 positive or has that medical diagnosis by a health provider. So the isolation is used, that's to indicate that that person does have the disease or has been diagnosed in that way. And isolation is typically 10 days. So we just highlight those three classifications of persons to just have that common understanding. And we also wanted to provide you at the onset a high-level flow chart of how we respond to COVID positive cases in FCPS. So as you'll see, as you look through this diagram, whenever we have a COVID positive case of a student, staff, or a visitor who's been on site during their infectious period, we enter what's called a red cap, which triggers a notification to our local health department, also known as the Fairfax County Health Department. During that time, we take guidance from the health department to examine criteria to identify who is possibly a potential close contact. Those persons who are potential close contacts are paused from in-person instruction, work, or other in-person activities pending contact tracing. So that relates in that yellow greenish box, that's relating to that pause that we talked about here that's in the mustard color. That's what we refer to the pause. The health department then conducts contact tracing. And so that might include calling those persons who have been listed, that certainly includes talking with that COVID positive case, doing all of their contact tracing and investigation process, and they determine which bucket those paused persons fall in. So if you're identified as not a close contact, you or as a staff person or the student will return to in-person instruction once you receive notification from FCPS. So as the health department walks through their process, they engage in ongoing updates and communication with FCPS. So once we know that you're cleared or your student is cleared or the staff is cleared, we send that notification alerting that person of when they can resume in-person activities. If on the other hand, you are identified as a close contact, If you're not fully vaccinated, the health department would direct you to quarantine. And again, our local health department uses a 14-day quarantine period based on the recommendation from the CDC. If a person is identified as a close contact and they are fully vaccinated in a student case, the health department, as we currently stand, will verify that student's fully vaccination status and also verify that that student is asymptomatic, so they don't have any COVID-like illness. If the student is fully vaccinated and also are asymptomatic, the health department will alert FCPS that you can return, that student who is fully vaccinated can return to school, and FCPS would send a communication to that parent or guardian. We've listed a resource here at the bottom of the website where we've hyperlinked our health and safety guidance document. Now, I know as parents and as staff, we have tons of things to do when we get home. So we're helping with homework, we're cooking dinner, we're doing a lot of things. And so we know that everyone may not have a ton of time to look through that, but if you're ever looking for, I wonder what FCPS's procedures are around X. The health and safety guidance document is the first place to start to really get some information on those topics. Again, as we shared before, we are constantly updating our information, updating our resources so that they're current. So we encourage you that if you have any questions and you're uncertain, start there as a starting place, because that'll give you a lot of information and doesn't require you waiting for somebody to respond. You're able to see that information yourself. However, if you have questions, we do have a number of persons who are here to assist and support our building leaders, our region offices, certainly the Department of Special Services. We're all here to support you and to support our families regarding this process. As it's a little bit different than last year, we realize that this year we have 99.5% of our students and staff in person and our staff in person. So while many of these procedures were in place last year, it was at a much smaller scale. And we know that some of our families weren't in person with us on last year. So much of this might be new. And again, we have many, many more students and staff in buildings. And so we are responsive to that, and we're here to support you in understanding this process.
So Dr. Boyd, question for you then. You said that the health department would be verifying if a student can be returning. Will they be asking for testing?
So here for the close contact, and I'm assuming that you're referring to this fully vaccination piece right now, we partner with the health department to verify students' fully vaccination status and also to ensure that those students are asymptomatic. So they will let us know that the student meets the criteria to not quarantine because they're fully vaccinated and they're asymptomatic. When we get that information from the health department, we reach out to the parent or guardian to say, little Michelle can come back to school, little Mike can come back to school. And we'll go through some more, because some of the questions that you have this evening will be answered in more depth in subsequent slides. So hopefully it'll become more and more clear to you, but we certainly want to make sure you have a good understanding of the process. Mr. Bloom, can you advance to the next slide? And in a moment, I'll turn it over to our colleagues, but we want to start by just giving you a visual, if you will, of what this COVID communication process is like from the FCPS side. There are a lot of moving pieces as we work collaboratively with our health department to ensure the safety of student staff in our building. And so you'll see that whenever there's a COVID positive case, we believe in being transparent. We believe in communicating with our stakeholders. And so there are a number of communications that take place to ensure that that's done. So when we look at it, once we're notified that there's been a COVID positive case on site during the infectious period, and we can talk more about infectious period in a moment, we notify those who we've identified based on the criteria that the health department has provided us, those persons who are potential close contacts. And don't worry, you're thinking right now, Michelle, what criteria is that? We have a slide on that too. So you'll see that momentarily. So we'll notify those potential close contacts, and that notification directs those staff and those students to pause from in-person instruction and activities. And again, that's to ensure that we minimize the likelihood of spread of the disease while contact tracing and investigation ensues. In addition to notifying those persons who've been identified as potential close contacts, Staff, we also have a staff notification. And so staff will receive notification when there's been a COVID positive case at their work site during the infectious period. Third, we also have a community notification. So we are communicating with families of when there has been a COVID positive case in their school so that they're aware of that information. Also, while we're talking about community notification and ensuring that the community is aware of what's happening in their child's school, we've hyperlinked here our FCPS COVID dashboard, where you can look at COVID positive data at the division level and also laser down to what's happening at my child's school. If my child goes to Frost Middle School and I just want to track what's happening there in terms of COVID cases, I can filter right on that dashboard and look only at what's happening at Frost Middle School. But again, if you are engaged and inclined that you want to look at the division-wide perspective, you're also able to do that too. You can look at your feeder schools if that's of interest. There's a number of different ways you can filter on that information, and you'll see student cases and staff cases for your review. So after that community notification, and we've paused those persons, we've notified our staff, contact tracing and investigation ensues. We will send a notification to those paused students and or staff once we receive an update from the health department that they are cleared. And when we say cleared, that means approved to return to in-person activities. So that group who was again paused that we talked about in this orange box at the beginning, that's when we let them know that they can now resume in-person activities. Some students or staff, however, through that contact tracing process that have been paused, may be directed that they need to quarantine, and that would be a result of if they were identified as a close contact to that positive case, or that they would need to isolate, and that's if that person subsequently tested positive for COVID-19. Finally, we send a community notification to the community, letting them know that the case is closed. So you'll see that there are multiple communications that come from FCPS, but during that contact tracing process, there's also other communication where the Fairfax County Health Department and their contact tracers are reaching out to those persons who've been identified as potential close contacts to have that contact tracing and investigation dialogue with them and to give them further guidance as to their next steps. At this time, I'll go ahead and turn it over to Ms. Gerbsky just to talk to you a little bit about close contacts, our K-12 indoor classroom exception, and to begin to walk you through the support for closure process if a student is paused, quarantined, or in isolation as a result of COVID. Ms. Gerbsky?
Hi, thanks, Dr. Boyd. Good evening, everyone. Thank you so much for allowing us to be here to provide this information. So as Michelle has talked about, we do work hand in hand with the Fairfax County Health Department to provide the information from our schools for contact tracing. And we follow CDC guidance in terms of what is considered a close contact. And here the question certainly asked about what is a close contact. And we did want to clarify that this year, close contact and definition by the CDC remains unchanged for someone who was within 6 feet of an infected person for a cumulative total of 15 minutes or more over a 24-hour period. The CDC has provided this as a definition of a close contact for some time. But this year, there is a K-12 close contact exception that the CDC defines. And you'll see that listed here in the blue box. And this indicates that in the K-12 indoor classroom setting, if there is student-to-student contact, so if you have one student that is being in contact with another infected student within 3 to 6 feet, then both the infected student and the exposed students, if they're correctly and consistently wearing masks that are well-fitting, and we have other mitigation measures in place in the classroom, they would not be considered a close contact. And then student-to-student contact less than 3 feet would be considered a close contact. So let's talk about this and break it down just a little bit more. What does the K-12 exception really mean in this language? It is for students in grades K-12, and this excludes pre-K. This is contact between students, so student-to-student contact, not a student contact with an adult. That would meet the criteria for adults with the CDC's definition of a close contact with 6 feet. And it only applies in classrooms. It doesn't apply to the cafeteria, gym, auditorium, football field, etc. that you'll see listed here. So in the indoor setting, if we have mitigation measures or layered prevention strategies in place and students are wearing masks, then there are some students for student-to-student contact that may be exempted from that. And you'll see also noted at the bottom that when the K-12 classroom close contact exception doesn't apply, the presence or face masks does not influence whether or not someone is a potential close contact. And the standard definition that we talked about in the green box at the top still applies.
Leah, may I clarify for one moment, please? You said this does not apply in lunchrooms, on school buses, outdoors. Is that correct? This is only in the classroom for the exception?
Yes, because students there are in structured settings in the indoors with layered prevention measures in place, and they are wearing well-fitting masks because we are putting those in place in classrooms. But in a cafeteria, students would be unmasked, so the distance would not, they would not have the exception. So that would be, as well, a reason why that would not apply to them. They would not be excluded from potentially being a close contact.
So it is our understanding that in elementary schools, the students have assigned lunch spaces, is that universal across the entire county?
That is in elementary schools at this time, and we have shared with our elementary school principals that we would like for them to have seating charts for students while they're in the cafeteria at the elementary level.
So, but sorry to clarify, would like is not the same as it's required. Is it required in all elementary schools or is it just suggested?
We have shared that requirement with them, yes.
Okay. And I'm sorry, I'm going to follow up on this with secondary because none of our secondary students have assigned seatings in the cafeteria. How is contact tracing being done? And again, also for school buses, I know for my kids, they can sit 2, 3, 4 abreast on the school bus, and how are we doing contact tracing there?
Well, we have another slide a little later in the deck that talks a little bit more about lunch and how we consider contact tracing. So maybe we could table that one. And I think Dr. Boyd, do you have your hand up for something that you might want to add?
Yes, I was just going to suggest, because I know there are some burning questions that you have. And we really try to make sure that we're pointed and sharing that information with you. But many of the questions that you're thinking of will be answered in subsequent slides. So if we could hold all questions, and again, I know it's difficult because we have these burning questions. If we could hold all questions till the end, and then we can certainly revisit anything that hasn't been addressed or hasn't been clarified.
I would just like to clarify, I am collecting all of the questions from the chat in a document as we go. So whether they're addressed at the time or not, they are being collected.
Okay, but I will mention just quickly, Diane, before we move to the next one, and Dr. Boyd, I'll make this a brief clarification. But as we shared, we're going to talk a little bit more about lunch and secondary as we move forward. But on buses as well, as we know, our students are not able to maintain distance. So any student that would be 3 feet or less, even when they're wearing a mask, would not meet the CDC exception criteria. So if there's 3 feet or less, they would be considered potential close contact. Can we move to the next slide, Mike? Thank you so much. So this is the slide that addresses, Diane, you asking about contact tracing for lunch exposure. How is this being ascertained? And, obviously at the elementary level, we do have seating charts. It is a little more difficult with our secondary students because some of them are eating inside or outside, although that is increasing the distance, and schools are certainly trying to do this to the extent possible. But yes, we do include all school activities when we consider identifying anyone as a potential close contact for contact tracing. This would include lunch and recess. And what we do is go through the process identified to us by the Fairfax County Health Department, and I've outlined this for you here below. If a COVID positive individual was on site during the infectious period, Then individuals, as we talked about before, when we talked about pausing, would be temporarily paused from in-person instruction or from work while the FCHD completes contact tracing investigation. The instructions that we provide to our administrators to consider the things that you see listed here below. Staff who were within 6 feet or less of another staff case for a cumulative amount of 15 minutes or more within 24 hours. So remember, the definition of a close contact for CDC with adult to adult contact is 6 feet. For staff who were within 6 feet or less of a student case, again, an adult contact with a student would remain a close contact at 6 feet. Students who are within 6 feet or less of a staff case, the same. Again, if you are having contact with an adult, it would not be considered, it would be considered a close contact. But here we have the K-12 exception. I'm sorry, that'll be the following one. Students wearing masks who are within 6 feet or less of a student case outside the classroom setting. And we talked about those additional settings like the cafeteria, recess. It's not a structured area where we have layered prevention strategies in place or kids consistently wearing masks. So we're back to 6 feet. But in the final one you see, and this is the K-12 exception, students wearing masks who are within 3 feet or less of a student case in the classroom setting for a cumulative amount of 15 minutes or more. So if it's less than 3 feet and it's a student case, they would be a close contact. But if it's a student to student contact, 3 feet or less, or of 3 to 6 feet, it would meet the K-12 exception. Mike? This one is asking about, I'm sorry, how we're providing instruction for a child when they're going to be quarantining, isolating, or pausing pending contact tracing.
And Ms. Dursky, I'm happy to jump in if you want me to.
Okay, this one was about special ed services. I wasn't sure, but I can certainly go ahead. Okay.
Certainly. And again, I apologize. I had a little delay in getting my camera on. One of the key questions that we know that stakeholders have had is what happens if my child is paused? And again, remember we said pause is when students or staff are temporarily paused from accessing in-person activities. So what happens if my child is paused? What happens if my child has to quarantine? And as a reminder, remember quarantine that means your child has been identified as a close contact of a positive case, and that child would be quarantining for 14 days unless they were fully vaccinated and had been released to return to school. Or what happens if my child is in isolation where my child has contracted COVID-19 and has to be out of school for at least 10 days. So we know that those are burning questions that you have. So we're going to walk you through what happens if it is an individual student or individual students. What happens if there is an individual teacher or teachers who are paused, quarantined, or isolated? What happens if a whole class has to be paused, quarantined, or isolated? And then what happens if we have whole schools that have to pause, or the division that has to pause as a result of a public health matter? We're hopeful, and we're keeping our fingers crossed. We know this pandemic is uncertain and we can't predict it. But we're hoping that we would not be in a place where we would have to close schools and or close the division. So we're hoping that that would be the extremely rare case that would happen. But we want to make sure that we communicate any potential likelihood of a closure to our families, to staff, and to students. So we'll walk through and just take a few minutes to walk through that process in terms of what is that process overall for all students right now? What are some special caveats for students with disabilities? And I just want to keep in mind that, again, as we shared at the beginning, the pandemic is fluid. The information and the guidance that we receive is fluid and adjusts as it relates to the pandemic. And so this information is subject to change based on additional local guidance, state guidance, or federal guidance. So we'll first look at the scenario if an individual student is paused. So little Michelle is a 3rd grade student. Is paused or quarantine or isolation. For some reason, I am not able to access in-person activities as a result of the COVID-related matter as it relates to a public health situation. So while Michelle is out, that 3rd grade student, She is going to, and as you'll see, the only thing that would trigger that is that we will be directed by the health department that Michelle needs to pause as a result of a public health matter while contact tracing has occurred, or that I've tested positive or have been identified as a close contact. And when we're looking at this particular screen, while little Michelle is paused or quarantined or isolated, the rest of little Michelle's 3rd grade class is still in school. They're still accessing in-person instruction. And I make that distinction because we do have a separate protocol for if a whole class is paused, quarantined, or in isolation. So in this situation, it's 3rd grade Michelle and the rest of her classmates continue to access in-person instruction. During that time, Michelle will receive support from my teachers, teacher-directed support through asynchronous assignments, and I would access that through our learning management system, whether that's Schoology or another hyperlink platform that teachers may be utilizing, or if there were issues with accessing technology or at the beginning of the school, maybe persons just aren't as comfortable with that. We would also provide printed documents, printed work for the students to pick up. And if there were any access issues, we certainly work with our community liaisons or social workers and other student support personnel to ensure that students got those assignments to complete that asynchronous work. In the case of students with disabilities, if you're looking at that last column, they will receive any support that's identified for students in general education. But in addition to that, the work that students with disabilities would receive would ensure that students continue to get FAPE, and it would ensure that students continue to make progress in the general curriculum and advance appropriately towards their IEP goals. You'll also note that if students are able to participate, if the student is well enough to participate in related services, if they had that outlined on their IEPs, and if parents or guardians have provided consent for teletherapy, that will be provided synchronously from those related service providers. So again, that's if the student is well enough. We realize that if a student is ill with COVID, that student may not be available for learning, and their first priority, and we support that, is getting well. And certainly if that's the case, we would continue to work with them once they're better. In cases,
I know you want us to hold questions. We had several questions about that paragraph right there about
and there's more information is coming, Michelle.
Okay.
Some information is going to be with some details to come. I know it's burning question, and I know it's so hard. I know it is.
Okay.
We're gonna have some more information.
Good. I have questions.
Thank you. From one Michelle to the other. In the case where a student has an extended absence, an extended absence means greater than 10 consecutive school days. In that case, and if the student has, as a result of a medical issue, the IEP team would gather to determine if homebound was an appropriate service delivery or if another model was appropriate. And again, that's triggered with those what's called an extended absence, because that would be considered a change in placement. As we go to the next slide, so we've just talked about students, individual students that would be unable to access in-person activities. In some situations, we have staff that are unable to access in-person work because they either have to pause or quarantine or isolate it. And so we do want to let you know that students would continue to get those services and supports and instruction, and a substitute teacher would be secured to assist with providing coverage. If the teacher is well enough to teach remotely, that teacher may patch in and work collaboratively with that substitute teacher. But again, as with students, if teachers aren't well enough to work, that substitute teacher would be leading instruction. In the case, again, we've made that same note here in the case that a student with disabilities will be receiving those related services, again, with parental consent for teletherapy, and again, assuming that that therapist or teacher is well enough to provide those services, that could be provided synchronously through teletherapy for those related services. And I moved a little bit quicker through those because the format and structure for these next categories will be similar. So we talked about an individual student not being able to access in-person instruction as a result of COVID, an individual teacher not being able to access in-person work as a result of COVID. And now we'll move forward to looking at what happens if an entire class is somehow impacted by COVID. That might be a situation where the entire class is paused. We have some classes that are smaller, particularly some of our specialized programs in special education settings that may only have 5 or 6 students in a class. And we have some classes that are larger, that have 20+ students in them. So our class size ranges. But in a situation that a whole class would be paused, quarantined, or isolation, excuse me, again, that pause would only occur as it relates to our guidance in collaboration with the health department, a pause to conduct that public health investigation or address those particular matters, or if that whole class had to quarantine, and we would hope that we wouldn't have the latter where a whole class would have COVID. But again, we plan for all scenarios. So in the case where a whole class would have to pause, that where all students and all staff are impacted, that teacher in those classes, that class would engage in synchronous instruction so long as those persons were able to do so. If the teacher wasn't well enough to work, they would not be able to engage in that synchronous instruction, and we would have a substitute. And in some situations, some students may not be able to engage in work if they became ill. And again, we understand that. This is where it gets a little bit different for elementary and secondary. And I know this is a question that was asked further down in the slide, but will be addressed again. But for elementary, by and large, we know that Michelle was in the 3rd grade class. I'm in Miss Jones's 3rd grade class. So if Miss Jones's whole 3rd grade class is paused, Miss Jones is virtual, her whole class is virtual, and we're engaging in synchronous instruction while we're paused for that class. However, Dawn is a secondary student. So Dawn is an 8th grader, and Dawn has different teachers for all of her subject areas and different periods. And in this scenario, perhaps it's just Dawn's Algebra 1 class that is paused. So for her whole Algebra 1 class that is paused, Dawn would engage synchronously with her classmates and with her teacher. But for her other periods, her biology, her science class, her English language arts class, her social studies class, she would engage in asynchronous assignments for those classes because her peers in those classes and those teachers for those classes continue with in-person instruction. So that's the slight caveat between elementary and secondary. Again, for students with disabilities, with the provision of any asynchronous and synchronous instruction, we would ensure that that remote instruction provided enables students to make progress in the curriculum and advance towards their IEP goals. The next scenario that we look at is when we have full school and division closures. And again, we're hopeful that these would not have to be used, but again, we're planning for all scenarios. In these cases, again, it will be directed by local state officials that we would need to temporarily close a school or the division as a matter of public health, and that the entire school and entire division in the division case would transition to virtual learning. Again, during that remote instruction, and we use the word remote instruction, when the state says remote instruction, they're addressing both synchronous and asynchronous. So anytime we're doing remote instruction for students with disabilities, we're always planning to make sure that that student with an IEP continues to have the ability to progress in the curriculum and to progress towards their individualized IEP goals. You can advance to the next slide, Mike. Thank you. So now we're going to talk about remote instruction just a little more closely and what that means. We know there was a SUPES memo that many of you all are familiar with that was released on August 18th that talks about remote instruction, that talks about school divisions being prepared to support students in light of a temporary closure, in light of quarantine, etc. And in that memo, you'll see words that say remote instruction and meaningful participation or meaningful interaction. Those are 2 important terms. And so with remote instruction, and I said this on the last slide, but that includes both asynchronous and synchronous instruction, and that we're going to share some additional information with you about how we're going to document and provide meaningful interactions with students who are participating in remote instruction, again, whether that's synchronous or asynchronous in the coming days as a result of their pause, quarantine, or isolation. So again, we know what remote instruction is. We know we have to have meaningful interaction, and we're going to be sharing some additional details in the coming days with the community regarding how that'll be documented in FCPS and how that will be done. Again, the key piece that we want to make sure that we're lifting up is that through all the supports provided, students with disabilities, the work that the staff are providing for our students with disabilities, that it must ensure that we're addressing those IEP goals and allowing them to advance in the curriculum as we talk about both synchronous and asynchronous instruction. So at this time, I'll switch it over so that you all can hear a different voice other than Michelle Boyd's for a moment. And we're just going to talk about some other general COVID questions. Some of the questions we weren't able to group as well, but we wanted to make sure that we were able to address all of the questions that you had while we're doing this time. So we're going to talk to you a little bit more about, one of your questions was about communication regarding asynchronous instruction. And then we're also going to talk to you about closure protocols. And just as I wrap up, I'll finish with that first bullet because it dovetails into the information I just shared. There was questions regarding how are teachers aware of planning for asynchronous assignments while students are at home? Have we informed self-contained teachers of asynchronous assignments and what concerns, if any, do they have? So we have been in ongoing communication. When I say we, again, multiple departments, our leadership team, ongoing communication with our principals. We engage in weekly principal briefings with our principals, and we have done so throughout the pandemic. And we also engage in problem-solving meetings so that we can unpack the feedback that we receive from stakeholders to see what things might we need to do differently, what might we need to tweak to enhance the process. So we've been in ongoing communication with our administrators who are parts of that problem-solving process as well. So school administrators have been informed that asynchronous instruction needs to be provided for students who are paused, quarantined, or in isolation due to COVID. And again, additional guidance is forthcoming, will be forthcoming to you and to our administrators about how they're going to document that meaningful interaction with asynchronous instruction. We wanted to make sure that our first week back in school really focused on identifying our kids and having that warm and welcoming environment for our students as they transition back to in-person instruction, because for some of our kids, they have not been in schools for 18 months. And so that's what we've done this first week. But we are going to be providing some additional information about what that meaningful interaction looks like and what you all can expect as staff, as families, and as our students around how that'll be done to document remote instruction.
Excellent. I'm very much looking forward to hearing more about that meaningful interaction. And I appreciate that you're addressing it because that does come out of the memo that was released days before school started. What about the first part of the question though, the demand on teachers who have to be planning asynchronous assignments for students who are at home?
Sure. So again, we continue to have to provide them with additional detail around what that meaningful interaction will look like. And so we'll get that feedback. But one of the things that we know, we want to uplift the needs of our teachers to support what they need and how we provide resources. But we know that inevitably, students may have to at times be away from in-person instruction.
Right, but the question is the demand on the demand on our teachers who now have to be planning asynchronous assignments.
Ms. Cates, can you hear me?
I sure can.
Okay, hold on, I think
I hear you.
I'm trying to find my screen. I can hear you, but I can't see you. Oh, it's back. I'm sorry.
No problem. I know. I'm rusty on it too. But how do you respond to the demand on teachers who now have to be planning asynchronous assignments?
Sure. So our teachers, as teachers, and again, you know, we can all speak from the instructional piece, but they're going to have to plan either way. We know that inevitably it's unplanned, right? COVID pauses are unplanned. COVID quarantines are unplanned. So we have to be malleable in that way. It's not what we will want to have, but we have to be flexible and we have to be willing to provide our students with that support when they're paused. And so we'll continue to work with our teachers, you know, once we roll out how that documenting that meaningful interaction will take place and get feedback from them regarding the resources that they might need. And inevitably, a lot of things with the pandemic, if we're just really, really honest, a lot of things with the pandemic adds to the workload of all involved. It adds to the workload of students. of families, and of staff. But we're committed to making sure that students are supported instructionally as we return to school.
So I apologize. I'm looking through our list of questions to see if this one is coming. So if it is, disregard. All of the investment that we made in technology, was there consideration given to at least live streaming classes when kids are at home? So that they can be keeping up with what's going on in the classroom?
Sure, thank you. We continue to talk about all options. We've received a number of feedback from various stakeholders, and the leadership team is reviewing and considering all of the options, and that's one of them that has been shared with us. And I promise we will have additional information in the coming days, and I apologize that I can't give you a solid answer on today, but I do want to let you know that that is something that has been shared with us from various stakeholders that is being considered by the team.
I appreciate that. Thank you for your candid response on that thrown in question there.
No worries. And I hope I'm not delayed a little bit. My screen is frozen, so I can hear you, but I can't see you. So
it's fine.
Okay.
Just keep on going. You're good.
Okay, sounds great. So at this time, I'll turn it back over to Ms. Sterpsky to talk a little bit more about closure protocols and how families can access some resources.
Thanks, Michelle. So where can families access information regarding COVID-related closures, and how are families informed of this information? And this ties into a couple of the questions actually that we previously answered. So when Dr. Boyd was looking at the information for a student, staff member, class, school, or division closure, there's also information, if you'll see here, where the link you can access all of our temporary COVID-19 closure information that addresses those same scenarios. And it basically lets you know that our prioritization is really to remain in person. We're looking for guidance from public health that would be closing schools beyond just pausing those potential close contacts. But all of that information is available and there for you on our webpage. With regard to how families are going to be informed of this information, we did talk a little bit about this before. Those school-based administrators, a principal or a designee, would be sending the communications that we outlined. It was the colorful slide with all the different information about a pause letter, a letter for our staff, a letter for our community, a letter to let individuals know when they are unpaused or they can return to work or school, and then a case closed letter that would let everyone in the community know that the health department has completed their contact tracing and investigation. So those that information and through the process will be communicated to you through a school-based administrator. You'll notice at the bottom, just in the highlighted area, the FCPS COVID dashboard does remain for this year on our public website. Our information from last school year was archived. It is still available for everyone to be able to reference. And then this year's information is referenced as of, I believe, starting August 13th or 14th, the day that our teachers returned to school this year. But all of our data for the time prior to that is archived and available for everyone to be able to review. So Mike, can we move to the next slide? Okay, so what constitutes an outbreak? So to share with you, through contact tracing and investigation, our health department is going to determine what would be an outbreak, and that will be based on the guidance from CDC and the Virginia Department of Health. The VDH outbreak definition you'll see here, and I'm just going to read this to you guys. It is about epidemiologically linked cases, so I want to make sure I get this information correct for you. So if you have 2 or more laboratory confirmed cases among students or staff with onsets within a 14-day period, and they're epidemiologically linked, meaning that through the contact tracing process, the health department has determined that one person of those 2 have transmitted to the other. If they don't share a household and were not identified as close contacts of each other in another setting, this would be meet the definition of a VDH outbreak. If an outbreak is determined by the health department, the entire school community will receive notification, and that will come from the school-based administrator. And the outbreak will be reported to the Virginia Department of Health, and that is reported by our local health department. And you'll see here the link to, if you're not already familiar with, but there is a VDH website that has outbreaks, and you will be able to find all of the outbreaks that are indicated there for educational settings, as well as other areas as well. Thanks, Mike. So is exposure in elementary schools being handled differently than for secondary? Guidance for determining our potential close contacts for COVID exposure is the same at all levels. And that matches what we shared with you on a previous slide, that administrators are looking for when they're determining close contacts, either staff to staff contact, student to staff, or student to student. They look at them across settings, and they also look for anything that might meet the K-12 indoor classroom exception. So when they're identified as a potential close contact, individual students will complete asynchronous assignments made by their teachers, as Michelle shared earlier, and assignments will be accessed through the learning management system at Schoology or be available for pickup at the school. In the event that entire class is directed to temporarily close, and again, we discussed this would be at the guidance of public health that this would happen, all students and staff in the impacted class would transition to synchronous virtual learning for that class until the class can reopen. But note in parens, it would be in that class period for secondary students. So this does highlight a difference in the response. So our process for determining exposure is the same, but the response and the guidance that may be provided to that student, elementary versus secondary level, might be a little different. So looking at the next sentence, during such time, secondary students in the impacted class would access work for their other classes via asynchronous assignments made by their teachers. And that would be similar to what we discussed for elementary age students. And assignments will be accessed through Schoology or picked up and available at the school. When must students test after exposure, and how long must they quarantine after exposure? So, and I did notice that Robin did put in the chat earlier that the health department recommends testing 3 to 5 days after exposure. But if you note at the top, students are not required to test following exposure to a positive case. So we did want to address that as well. But following the health department's recommendation, students will be tested 3 to 5 days after their exposure. And then FCHD uses a 14-day quarantine period for students that are identified as close contacts. So in these cases, even if a student received a negative test result after they were determined to be a close contact, their quarantine period of 14 days would not be shortened. And the student wouldn't be able to access in-person instruction until the quarantine is completed. They would either have a return to school form or a clearance letter from the health department releasing them to come back to school. But to offer further information, the FCHD, like the CDC and the Virginia Department of Health, looks at that 14-day period for quarantine as the preferred length of quarantine, as it is the safest as well. How long are those who test positive required to isolate, and is a negative test required prior to returning to school? So our partners at the health department or medical provider would be the ones providing direction regarding isolation. So as we shared, FCPS only pauses potential close contacts. A COVID positive case is typically directed to isolate for 10 days, and a negative test is not required to return to in-person learning. The return to school form or a return to work form for a staff member must be completed before a student may return to in-person learning or to work. You'll find the return to school form on our webpage. It's on the health and safety guidance document, and there are translated versions of that document available. And then copies of FCHD clearance letters, or also known as SARA alert forms, or a healthcare provider note, are also accepted for students to be able to return in these cases. And the clearance letters are provided by the Fairfax County Health Department. Who will be responsible for sending out notices to students and families? The school principal or designee provides our COVID notifications to our stakeholders. The Fairfax County Health Department and FCPS provide resources regarding COVID-19 support understanding of COVID-19 and the contact tracing process. This information is included in the letters that we send to our community, our staff, and to any individuals that are potential close contacts have been identified through the process. So here you'll see the resources that are listed, and you also see some contact information that we share with those in our letters where they may contact the Fairfax County Health Department.
Quick question for you. Oh, there it is. Never
Go ahead. Okay. How are we communicating exposure and closure to our families that are English language learners? As I shared, we are currently translating all the information in 8 languages, and you'll see those listed here. We do need to respond quickly to these. So right now we are pushing out communication via written translations and documents for families. At this time, we haven't mandated phone calls be made in addition to the electronic correspondence regarding COVID cases, but we certainly will continue to review that over time.
What do you do in the case where families don't have access to email?
Well, typically, as we go through the process, principals are also connecting with families, each family, and providing that guidance. So for example, if a student would be identified as a potential close contact by the principal, say on Monday, schools are monitoring to see if students are returning to the classroom, and maybe if they need more information or guidance, reaching out to them to share that information. So that we certainly are looking to safeguard schools and exposures and making sure that families are aware of those requirements. So we have not yet had that as an instance. We're continuing to monitor it, but there are some safeguards in place where people are getting personal connections with staff members as well. And often they're calling and asking administrators or school staff questions, or we have parent liaisons in the schools that can provide additional information for them as well. Will FCPS be doing proactive testing for all students exposed to COVID via close contact? We do partner with the health department for diagnostic testing for our in-person close contacts, and they provide that testing for us and information and resources for our families and our staff. But we are going to be working to identify additional partnerships with other third-party providers that will be able to provide us with testing access. Has FCPS considered making testing available to all families free of charge and logistically accessible? We prioritize the health and safety of our schools, and we have been implementing layered prevention strategies as recommended by the CDC and the Fairfax County Health Department to the extent possible. We know that screening testing or surveillance testing is a layered prevention strategy, and we do plan to implement that during this school year. So as we shared before, we will continue to partner with the Fairfax County Health Department that's offering diagnostic testing for individuals who have symptoms of illness, become ill at school, a teacher or a student that becomes ill at school and has symptoms of illness. And we will partner with a third-party provider to provide access to surveillance testing, which is also screening testing or testing for asymptomatic individuals that will allow us the ability to screen and monitor for those who may be coming in and transmitting the virus without knowing that, since they have no symptoms. And FCPS will continue to share community testing resources with our FCPS families. We want to make these resources as accessible as possible. And here is a question.
Do you have an anticipated date that that screening or surveillance testing might start?
We do not have a date on that yet, but we are working on it at this time, and we hope to have some information out to our community as soon as we possibly can. Obviously, there are many schools looking to implement some of these things as well, so everyone is kind of looking towards some of the same resources, and it does take some time to get things operationally in place and ready to go, but we hope to have that as soon as possible. The next question, if you're in an outdoor crowded setting or participating in activities with close contacts with others who aren't fully vaccinated, wearing a mask, particularly in areas of high numbers of cases, this is something recommended by the CDC. And you're asking, will masks be recommended for outdoor activities? If you haven't had the opportunity to review, Regulation 2109 is our face covering regulation. And here we've just included that in one of the sections, we do mention in areas of substantial to high community transmission levels, that students, staff, and visitors will be encouraged to wear their face coverings in crowded outdoor settings or during activities that involve sustained close contact. But we are currently reviewing our requirements for the wearing of face coverings for students, staff, and visitors while they're outside on school property. And this may be something that, as we mentioned here, with if you have substantial and high transmission, there may be times when FCPS will be recommending that we do that. So we are currently in the process of reviewing that.
And would that be including things like recess?
Yes, it would. And will there be separate quarantine rooms in the schools? We call our rooms care rooms. And these are the rooms that if students present with COVID-like illness, they are going into the care room. We have staff that supports those care rooms and are aware of how to respond with the appropriate layered prevention strategies and personal protective equipment. The care room is a separate room from the school health room, and that room is used to assess students who present with COVID-like illness or CLI. And then if the student is to be sent home with COVID-like symptoms of COVID-like illness, the student remains in the care room until their parent can come to pick them up. And we do ask that parents try to pick their students up within an hour because simply one, they may not feel well, they're in the care room, they are separated, from others while they're there. And that we want to make sure that they have every opportunity to get home and be with their parents as soon as possible.
So I know what the clinics look like in our kids, my own kids, elementary, middle, and high school. When a child isn't feeling well and goes to the clinic, they're literally standing in the same vestibule with the kids who are there to take, for example, their ADHD meds or get their blood sugars checked or whatever have you. Once a kid is sort of triaged that they're not feeling well, they go into that care room. But what do you do about the intermixing prior to that triaging?
Well, at that point, if a student comes from a classroom and they call down and take the student to the care room with symptoms of COVID-like illness, they should be taken directly to the care room for that. Because it is separate, given the symptoms of COVID-like illness, that the student would go to the care room as opposed to the health room, which students there are not necessarily demonstrating those same symptoms of illness.
And I get that at the elementary level with sending kids down, which, as a side note, in the elementary schools, kids are sent to the clinic with a buddy. So I'm curious how the procedures are going to change at the elementary level, because you're not going to want to be sending a buddy and exposing the buddy. But middle school and high school, you've got kids who, might be coming from lunch and go into the clinic. They're not going to be called in advance and say, I'm sending this kid. Is there going to be standardized signage? Is there, how are those separations going to happen?
So just to give some feedback, and I apologize that I'm not putting my camera on, my computer tends to glitch a bit when I put my video on. I'll try to get in a moment. But based on, and your question was right, in some instances, our older students might elect to go to the health room. Students remain masked. And so if the person who is supporting the health room determines that those student symptoms are consistent with the COVID-like illness, that student will be then sent to the care room. And those parents or guardians would be contacted to pick those students up. So there isn't really a perfect science, because as we all know, particularly for those who have little ones, there are so many illnesses that one might think that might just be a seasonal allergy, or I just typically get a cold during this time, but we just have to act out of an abundance of caution. And so as our elementary teachers are making assessments do I send the student to the health room or the care room, we do have persons that are there that will make that distinction, even if they report to the health room, to be able to send them to the care room. And likewise at secondary, if they go to the health room, to send those students to the care room. But again, at all times, those students are to be masked unless the student naturally will have a face mask exemption. for the small number of our students that have that level of support.
And since the health rooms or health clinics do fall more under the health department, Robin, I know you're on the call as well. I'm going to strongly encourage that you all put up at minimum some signage about this. I was over at our school's clinic turning in medication before school started and saw no signage whatsoever about this.
Yeah, I can't speak to the signage, but I can definitely check on that. I have witnessed the screening that happens at the door. So I think our school health aides are trying to be very diligent about directing students directly to the care room if they are exhibiting illness symptoms. So they're very, very cognizant of that.
Thank you.
And in what ways have FCPS updated its policies and prevention strategies to take into account the changed situation now that Delta is a predominant COVID variant? Obviously, this has been a game changer in a lot of different ways for FCPS, but really the key term here is change. And so that we look to the CDC, we look to their guidance, and they have shared students benefit from in-person learning, and safely returning to in-person is our priority for this year. We do follow the guidance of clinical researchers and medical providers, and this includes the CDC and the VDH. We work closely with the Fairfax County Health Department as well to promote safe classrooms. Here you'll see links to where we make our guidance available for the public to be able to see the mitigation measures, the layered prevention strategies, that we're putting in place in our schools. But just to know that we are monitoring this information constantly because it does change, and we evaluate the impact of new variants as well. The CDC provides that guidance, and we implement those things within our schools. We change flexibly over time, and certainly we'll continue to partner with the health department to determine if there's anything additional or different that we need to change on our end based on public health guidance over time. And we monitor that consistently.
And at this time, we're going to turn it over to Mike Bloom and or Don Schaefer to provide us with some special education specific updates outside of the health realm.
Great, thank you, Dr. Boyd. So I know that's a lot of information that you've all just listened to and processed. And the first portion of this really dealt with COVID-related questions. And so now, as Dr. Boyd said, we're going to shift a little bit because there were some other questions that you had asked related to other areas involving our students with disabilities. So the first question was in regards to how FCPS plans to address special education staffing challenges. And as we all know, special education teachers continue as an area of critical shortage, not just in FCPS, but across the state and really across the nation. So a few things that we've done. Our Department of Special Services, we for a number of years have collaborated with our Office of Talent Acquisition and Management, which is in the Department of Human Resources, around recruitment. And we've done a number of different things with them. One of the things that we do is we get a list every year of the university instructional job fairs that are taking place, not only locally, but throughout the United States. And we really look for universities and programs that have special education endorsement areas. We've gone to Pennsylvania and Penn State. They've got programming for special education teachers. A number of Virginia universities have degree programs for special educators. So we're being intentional in trying to look across the country for opportunities to engage in those instructional job fairs. And Human Resources a few years ago gave us the opportunity to offer early hire contracts to qualified candidates. So we have embedded in those job fairs, along with Human Resources, members of our Office of Special Education Instruction team, and we're providing interviews on site, either virtual and, pre-COVID, we were in person and providing job interviews and working closely with HR to be able to offer some of those early hire contracts. A couple of other things that we do also recruit at national conferences. So the last number of years at the CEC conference, when it was in person, Human Resources would have a table in the exhibit hall, and we would have members of our Office of Special Ed Instruction team there, and we would talk with potential candidates, and we would again provide some on-site opportunities to interview, and HR was right there along with us to provide those early hire contracts if they were qualified. And then this year, the ASHA conference, the American Speech, Language, and Hearing Convention, is right here in Washington, D.C. So we're looking to send quite a few members of our communication disorders program to the ASHA conference and convention this year, so that, again, we'll be able to recruit. And hopefully, one of the advantages of having it local is that you're getting a lot of the local college grads that after they graduate are looking to settle down and looking for career opportunities right here in the Washington, D.C., Virginia, Maryland area. So we're hoping that we'll be able to recruit quite a number of speech and language pathologists, which again is a big area where we try to recruit. The other thing that we do is we partner with George Mason University. We host a number of information sessions with them, trying to attract individuals to the field of special ed. During these information sessions, members of GMU will talk about some of the licensure options that are available and the required courses and classes that they're going to need to become a licensed and endorsed special education teacher in the state of Virginia. And we are going to have an information session tomorrow, and then we're going to be scheduling another one for mid-September. We do also, I didn't put this information here, but we also have a number of cohorts where we partner again with local universities to put many of our instructional assistants through a cohort program that at the end of that, they become licensed and endorsed special education teachers. And we're all
I'm sorry, for the sake of time, I'm going to ask if you would please move on. We actually have a teacher with us who has a question about the next question, and I'm just trying to be mindful of time because I know we have a bunch of other questions.
Sure. Okay, the next question then, how do we plan to address the staffing issues that result in multi-grade level self-contained classrooms where teachers get neither lunch nor planning due to lack of staffing? And again, we know that for some teachers, this is an area of concern. And what we've tried to do is work closely with those administrators of those buildings to problem solve these situations where they're occurring. And then, of course, as they're occurring, myself, Dr. Boyd, Dawn Schaefer, our director of procedural support, can get involved. We do realize that, staffing, again, because of the way that staffing occurs within a school building, sometimes there is a need to combine multiple grade levels, but we try to minimize that to the extent that we can in order to be able to separate lower grades or upper grades at the elementary level.
Mike, I'm gonna actually recognize our staff liaison, Amy.
Hi, so I'm just speaking as a self-contained enhanced OT teacher in my building, as well as a lead special ed teacher in my building. Not a single one of my Cat A teacher or Cat B teachers this year or this past week have gotten a lunch. That's 6 educators and 4 of their IAs did not get a lunch. We also haven't gotten planning in years. It is very frustrating as an educator to hear the rhetoric of we recognize our students by name and by need when our students aren't being recognized by their needs. Many of our students in our self-contained classrooms have significant needs, and for safety purposes, we need to keep our ratios as they are. I have friends in the county whose classrooms are out of ratio. And yes, that is a major staffing issue, and it's a staffing issue now. It's not a staffing issue for something to think about as teachers who might potentially in the future be interested in becoming an educator. It's something that's happening right now. I am not comfortable leaving my incredible instructional assistant alone in my classroom because of the safety needs of my students. Therefore, I don't get lunch. I don't get planning. I am legally obligated to have a 30-minute duty-free lunch, and I'm not able to do that because the county and staffing look at numbers on a piece of paper. They say, Miss LaCrosse, you have 6 kids in your class. Here you go, 6 kids, you're within ratio of 2.25 to 1. You're not looking at the needs of my kids. And so it's very frustrating that way. And then from an equity standpoint, which is a huge piece in Fairfax County right now, it's not equitable. My fellow teachers get 360 minutes of planning a week. I get 0. That's a problem. And I don't know the solution for it. I recognize and fully understand that we have staffing concerns, but there are safety issues within our buildings that need to be addressed because it's not equitable. And it's very frustrating as an educator, speaking on behalf of my colleagues who are not getting lunch, who are not getting planning, to hear all this talk of equity within the building when it's not happening.
Ms. LaCrosse, thank you for sharing those concerns. And we are following up with some of the concerns regarding planning, regarding unencumbered lunch, and regarding staffing ratios. As recent as last week, a team of persons, principals, persons from DSS, finance persons, we met to discuss those staffing ratios and to discuss some next steps around that. So I'll reach out to you personally because we do want to make sure that we're addressing these needs and also to make sure that we're taking the teacher voice into consideration, but we are aware and are actively trying to change that. We certainly appreciate with sincere hearts all of the work that our staff are doing. And you're right, you need, not only are you required to have the unencumbered lunch, but you need to have that so that you can be the best person for your kids. So I just want to share, I know it's not the answer today at this moment, but I want you to know that this is a very high level priority for us to make sure that our special education teachers have their due in terms of planning time and in terms of their unencumbered lunch.
Thank you for that. We appreciate that. I speak on behalf of all teachers through these challenges, recognizing that.
And knowing what questions we had left on our list without having seen your slides, some of the questions I was actually going to ask if we could hold on to them for a later date, just because they are vital questions and just a little bit more detailed, specific. And we have some other general questions that we really wanted to circle back to. Are you all right with us jumping back and going that way at this point?
Is it okay if we just quickly just hit the instructional materials? We know that
yes.
Yes. You know, that's been a critical piece. So I know there's lots of burning questions, but if we could just hit that really fast.
Yes.
Thank you so much.
Absolutely.
Okay, so I'm going to very quickly address this question. It was a question related to our digital content, Imagine Learning and ST Math, and the accessibility of those supplemental programs. And so just to let you know that these conversations have been very recent, and our Office of Special Ed Instruction did have an opportunity to meet along with instructional services. And we also had a meeting with the developers of ST Math, and we've got one coming up with Imagine Learning to address the accessibility for students with visual impairments. So the developers of ST Math have committed to partner with us around accessibility with their digital content, and we're going to be piloting and partnering with them to develop some additional accessibility features for students and also some instructional resources for our teachers who support students with visual impairments. So we just wanted you to know that even ongoing, we're committed to collaborate with vendors to procure accessible content. We are developing a team. We've developed a team that is going to be actively working on this project. So I know it's an area of concern, an area that we hadn't addressed fully via a team coming together and looking at this, but that's something that we're committed to doing now.
Mike, that's a great update. Amanda has a follow-up question on that.
Hi, Mike. I see that you've written in here that that they are partnering to support students with visual impairments. I want to ensure that the needs of students with motor impairments are included with this as well. As a parent of a child who has motor impairments, we used ST Math and Imagine Learning last year. We were in a Schoology pilot school as well. It was very difficult, ST Math especially, because what you're asked to interact with on the screen is incredibly small. So for students with mobility impairments or any kind of motor impairments, it was very difficult for them to independently access the screen, even with having the assistive technology help. So if that could be taken into consideration as you work with ST Math, that would be great.
Excellent. Yes, thank you for that feedback. We will make sure. We mentioned visual impairments here, but we're certainly going to be talking about other areas with them as well. So thank you. And this question was with regards to our district procured publishers providing NIMS files to NIMAC. And we just wanted to give you quickly some information that the Department of Special Services, and again, instructional services, we partner together to ensure that individuals, that someone working, again, with some of our publishers has an accessibility lens as part of the review team when we're making division-wide purchases. This is an area of opportunity that we're looking forward to implementing, and we do have some current resources to assist with accessibility. And of course, many of you are familiar with AIM Virginia. I won't read through the whole thing, but this sort of outlines how AIM Virginia does provide accessible instructional materials to eligible students. And again, it talks about the criteria for a student to be eligible to receive those.
And if a parent is not familiar with AIM Virginia, who do they talk to at their school?
If they're not familiar, they can reach out to their student's case manager at the school level, and that case manager, special education case manager, will be able to provide that information. At the
wonderful
level,
Mike, I think one thing we might want to look at, because I've actually had this happen to me personally, and I know several people. You go into the IEP meeting, somebody mentions AIM Virginia, and the parent says, "How do I access AIM Virginia?" And the IEP team looks at each other and says, "Well, we don't really know. Here's the pamphlet." So I think we need to make sure our case managers and our IEP teams are actually trained in how to walk parents through the process, because it's actually not very simple. Thank you.
So I'm not sure, those were the couple of slides related to some of the accessibility things that you had asked. So maybe a good stopping point, Michelle, if you want to open up for some additional questions.
Yep, we actually have some follow-up questions. Dawn, did you have something you wanted to add?
I did, about AIM Virginia. Every school is supposed to have what's called a digital rights manager who does manage that process. And the concern about this and that feedback, and thank you so much for that, that's giving us a reminder to double check on that and make sure that we are communicating out to our folks, and that our case managers know who to identify for that and to seek that assistance. So thank you.
All right, I think what I would like to do, we have an incredibly long list of follow-up questions that I know we don't have anywhere near the amount of time to get through as I wish we did. Before I jump into them, if you want to close up your screen share or not, that I may actually go back and ask you to reference some of the slides from earlier, so if you can keep it relatively handy, that would be great. But I wanted to first of all just say thank you for putting together all of this information. This is without a doubt the most comprehensive and detailed information that I know I have seen since we've come back to school. So I'm hoping that we'll be able to get copies of this information, and that you'll be actually putting this information up publicly on the FCPS website, because this is way more information than honestly that I expected to receive tonight. So first and foremost, I want to say thank you for that information. Yay, I'm seeing some claps coming up here too.
Also, one thing that makes it so helpful is that it's all in one place. On the website, there's been a lot of check this link for that and check that link and go to the health department. And it's so confusing from the parent's perspective that having it in one place is awesome. Thank you.
So I wanted to go back and just follow up with a couple of questions. Going back, and actually, Mike, if you can pull up the slide that talked about what happens when kids are out of school. I should have written down the slide number, and I'm sorry I didn't. It had, I think, 3 or 4 columns on it. Yeah, there, yes, okay, that's the one, excellent. So I see on this that you do address here that if students can receive their PT, OT, speech and language through synchronous sessions. This is when an individual student is out, not an entire class. So just to let everybody know where I'm coming from on this. But we had many questions coming out about concerns about how kids will access the asynchronous class work that is being given to them. That's their special education, the primary instruction time. Are families going to have to be providing all of the accommodations and support, or essentially teaching that information? It does not sound like FAPE. I think FAPE and asynchronous don't go together. And so I know there's been a lot of concern about how will our students access their asynchronous instruction, given that they're special education. I know it says we're going to make sure that they're making progress in the curriculum and advancing, but how is that going to happen?
So thanks, Michelle. So the way that teachers support students, and this is where we talk about that meaningful interaction, that more information is coming with that regard, because that's going to impact to a degree how students interact with staff, how students document or demonstrate that they are making progress or that they need additional support. So that information, when we provide that additional detail, I think that will help address some of your questions. But I do want to say that we know that any support that's provided when students are out, is not the equivalent, as we quickly found from last year looking at our data, is not the equivalent of what students receive when they're in person receiving instruction. We saw that last year when we were all virtual. So I don't want to pretend that that is not fact. We know our data indicates that that's fact. But we are committed to making sure that when students are out, that they're receiving supports as well as receiving FAPE. And again, I think that once we provide some additional details around that meaningful interaction, I think that will help address some of your concerns. And we're still finalizing that information and hope to have that for you in the coming days.
Yep, and again, I do completely recognize that a lot of these questions come out of this superintendent's memo that came out on the 18th, which really didn't give you a lot of time at all. So like I mentioned earlier, I'm definitely eager to see, for example, how students can access their teachers in real time while they're doing asynchronous work, because it describes asynchronous as if a student is working independently in a classroom with the teacher there, which is awfully hard for kids who are receiving special education. Another point that it mentions is that students are not supposed to be locked into their remote option.
Correct. And so there's going to be some updated information coming out again. We all understand that information evolves over time. And so we're extremely appreciative of the resources that we get from our State Department of Education, our health department, our local health department, all levels. But we did receive clarity that within that memo as well, that persons who elect to engage in virtual instruction can't be locked in. So i.e. Initially, students would only be able to transition from the virtual program back to FCPS, not back to FCPS, back to in-person and FCPS buildings, excuse me, at the semester. And with that additional clarification, we know that let's just say, for example, little Michelle again is in virtual. The vaccine becomes available for kids under 12. I'm fully vaccinated, and now my physician has indicated that it's safe for me to return because now I have that vaccination. That my parent or guardian is able to reach out then and say, we want little Michelle to be able to come back to ABC Elementary School, if you will. So we realize that, and we're excited about that, to be able to support students in that way, and we'll be sharing some additional information in that vein.
And the superintendent's memo doesn't really, I don't think, address my next question, which is, are you going to be making allowances for that to actually go in the opposite direction for students to opt in to virtual?
At this time, we are not. We have not made any decisions that students will be able to opt into virtual.
Okay. All right. Amanda, I know that you've been collecting all of our questions here, and I'm just trying to quickly look through them and figure out what some of your abbreviations and highlights are.
While
we're taking a look, Jenna White, would you like to just share about the FCC PTA survey?
Sure. Hi, good evening, everyone. FCC PTA has been hearing a lot of concerns as well about lunch. So last week we put together a survey. Actually, Kara Jenkins, our president, put together a survey. We did release it, I think, Wednesday or Thursday. We're getting tremendous response. I think we already have almost 1,100 responses since then. So I'm going to pull it up really quickly, put it in the chat. Feel free to share it on social media or email it out to other families. We are thinking of closing it on Friday because we want to move on to passing on the results of the survey to leadership. That is a little bit flexible if need be, but if possible, please do try to complete it by Friday. It's also on the FCC PTA Facebook page, and I'm sure it's on SEPTA, but I will put it in the chat right now. Thank you so much, Michelle, for the time.
Absolutely. Thank you for passing that along. As I'm looking through, Amanda, did you want to jump in, or do you want me to pull some of these questions?
And Michelle, can I just add something while you're looking at that, just in regard to the cafeteria? And thank you so much for sharing that feedback. We've received a number of great feedback and a lot of feedback around cafeteria, particularly at the elementary level where our kiddos by and large are not able to be vaccinated. And at our recent board meeting, our board allocated funds and made some directives of the superintendent to allocate funds to be able to support monitors, to be able to support really spacing kids out in different areas, accessing outside eating. We know that we need to continue to supervise those students, but there were some additional resources allocated in ESSER 3 to be able to support that. So we're really appreciative of the board and making that decision and providing that directive. And so I think that there will be some additional options made available at a number of our schools to be able to support some increased spacing of students during those meal times where the masks are not on. And I know we have board members on here that they want to, I don't want to steal their thunder, but I just wanted to put that out there since the conversation was in that direction.
Right. And I apologize for jumping around a little bit with some of these questions here. I'm trying to pull up the ones that we've heard numerous times as well. One is, what happens to the close contact exception if a class has a student, or students who have mask exemptions?
Great question. And I think I started typing the answer and then I don't know what happened. So Mr. Bloom, if you would do me a quick favor and pull up the slide that on K-12 classroom exemptions, on the K-12 indoor classroom exception. So one of the key pieces, as Mr. Bloom is pulling that up, is if the COVID positive student is not wearing a mask the whole time, or if the potential close contact is not wearing a mask the whole time, the K-12, keep going back, it's in the earlier slide, I think, Mr. Bloom, where there's some boxes, it might be a little easier to unpack. Keep going. Maybe it's later. Maybe it's earlier. I think it's earlier. Yeah. It should be maybe right before. Yeah, there we go. All right. If the positive student is not wearing a mask the whole time, and if the potentially exposed student is not wearing a mask the whole time, then this K-12 classroom, indoor classroom exception does not apply, and you default back to the standard close contact definition of is the person within 6 feet of that infected person for a cumulative of 15 minutes during the 24-hour period. And so that's really, really critical. And we know, again, that some of our students require levels of support where they have mask exemptions for various reasons. And in those cases, we do have to go back and utilize that standard close contact definition. Does that answer the question? I think, I forgot who put it in the chat. I was trying to type earlier.
I don't have that information either, so I don't know. Although speaking of mask wearing, I'm going to jump to, well, Emily just threw in an important question is why are we still using 6 feet when we know that this is aerosolized, similar to like cigarette smoke. It doesn't stay within 6 feet. So that may be more of a question for Robin.
Sure, I'm about to say we're using this information from CDC and DDH and the Fairfax County Health Department, but we certainly welcome Robin's voice into the room. Thank you again, Robin, for joining us on this evening. And I just want to share with the group that Robin volunteered to come and participate in the evening hour after she worked a long day. So again, I think that really speaks to the partnership and collaboration with our health department. Go ahead, Robin.
Sure. Well, so standard science does still feel that 6 feet is the appropriate close contact distance. The one thing we do know about, or we know several things now about Delta, but it's much more contagious than other variations of the virus were. So that's also a concern. And that's, I believe, why public health authorities have maintained that 6 feet distance.
Speaking then of the distancing and the thinking outside beyond that classroom exception, there have been many questions about school buses. So if you have a child who tests positive who rides a bus, does that then essentially put that entire bus and possibly the driver in a need to quarantine?
It would still be that 6 foot distance. So it would be all the people within 6 feet of that individual who is positive.
And how are we keeping track of that? Because certainly for the older students, they don't have assigned seats on the buses and aren't going to be able to name the other kids who are sitting any rows around them. They may not even be able to name the people who are sitting next to them, especially when we have buses where we're sitting 3 high schoolers to a seat.
So if you really had a situation like that where you could not identify where students were sitting, most likely the bus would get paused, the entire bus, and then our contact tracers would need to begin interviewing each individual student. So it's much more time consuming, but that would be how they would handle that investigation.
That's pretty much my concern about lunching and even outside activities, especially in secondary school. The pictures that have been sent by teenagers in our schools home to parents are truly horrifying. They are crammed. There's, 4 kids sitting in a booth in the lunch table, like this far away from kids eating. And again, that means that people would have to know who's sitting near them, remember who was at their table that day versus the day before.
And they don't know each other.
And they don't necessarily know each other, and they all, so I guess that's the question is, it sounds like a lot of this, especially in secondary, is self-reporting. Like the teenager just has to remember. Or even in the younger grades, they're outside playing and they just have to remember, who was I playing tag with that day?
Right. Well, and there's also, especially with the younger students, there's interviews that happen with the teachers. So it's not just the students that they're relying on. There was a group waiting today to find out their disposition, and they were just waiting to talk to the teachers. So it's, in order to be comprehensive, they do try and speak with as many people as they can. And yeah, it's difficult and it's not perfect, but I think they're doing the best they can. We have all our students back. So
yeah, always. And
what we're dealing with.
We've certainly been hearing, and thank you for joining us tonight. We were not expecting you at all, so this has been incredibly helpful. And also say thank you to your contact tracers.
Right. I feel like they need a lunch out or something. We have, just so you know, we have 40 people that are working just on school investigations. That's pretty amazing. And they're working 12-hour days, 7 days a week right now. So lots and lots of manpower and woman power going towards this.
Well, we certainly appreciate it. I know that on our groups, we have seen multiple reports of multiple kids or half kids or whatever have you. And we really, appreciate, and I honestly can't fathom how much work that there is. So thank you. I also want to say thank you to all the FCPS staff who joined us this evening. I know it is 9 o'clock, and again, we weren't expecting all of you either. So, feel free at this point to hop off, enjoy the rest of your evening, prepare for tomorrow is another busy day. We have lots more questions that we'll certainly pass on to you as well. I think at this point, and I'm looking into my screen at Diane, that what I would like to do is say thank you and good night to particularly to all the FCPS staff who need to turn in, and thank you for your time. And if folks would like to stay on, depending on how many of us stay on, we can potentially facilitate just a little bit more informal dialogue for a few minutes at least. Diane?
I was just gonna say, it does look like we have one hand up. Lenora has her hand up. Did you have a question, Lenora?
I hope Lenora's question was the comment of membership. Please join SEPTA.
Here she is.
Yeah, hi. No, I just forgot that I had my hand up and forgot to put it back down.
But if you have enjoyed this program tonight and gotten some new information from it, I would encourage you to please join SEPTA. This is how we bring out information for you all. So again, please go to our website and join SEPTA, and remember that I'm making a plea for donations. So thank you for that as well, or volunteer to be our fundraising chairperson and get me out of that role for sure. So let's just kind of see how many people we're down to at this point. And thank you again to all of our FCPS staff who came, and thank you very much, Dr. Boyd and Mr. Bloom, for pulling together all of that information. I know there will always be more questions. And like I had said earlier, I really was not expecting the quantity of information that came out tonight. So thank you very much for that.
And thank you for the opportunity. And we know that it was probably information overload, and this was not the instructional strategy that we would typically use for kids or adult learners. But we know that there's a lot of burning questions, and we'll continue to provide some updates. But thank you all so much. We wish you a great evening and a great start to the second week of school. Take care.
Thank you.